everyone, my name is Katrina. I'm a pelvic floor physical therapist, and this video is all about how to perform the ileocecal valve release. So the ileocecal valve is located between your small and large intestine, and it makes sure that things aren't flowing backwards. So if you think about your digestion, you have your mouth, your esophagus, your stomach, then your small intestine and your large intestine. Stuff or food should be moving from your small to your large intestine. Now the ileocecal valve, it's very important because it really makes sure that food or bacteria isn't flowing backwards. So all the really good bacteria and just microbes and all that in your large intestine shouldn't be moving backwards up into your small intestine, because if that happens, that can also contribute to SIBO, or a small intestinal bacterial overgrowth. So today I'm going to show you how to perform the ileocecal valve, and this is really helpful for my clients who kind of feel stuck in that region, and oftentimes when this is released, it really helps improve the flow of stool and just the food throughout your colon so that things are moving in the right direction. So all you're going to need is a yoga mat, or you can do this in your bed. You'll just want to lay on your back. You'll just need your 2 finger pads to kind of sink your fingers in and push, and then we'll do some leg movements with our leg. So we'll have you lay down first. Okay. So just to orient yourself, you have your belly button and then your hip bone here. This little bony landmark known as your ASIS on the right side is going to be our other landmark. So we're going to have our belly button, our ASIS, and we're just going to draw a line between those 2 landmarks. Now, 2/3 of the way from our ASIS towards the belly button, we're going to actually sink our fingers down, and you might feel almost like a tight spot or something rigid, and all you're going to do is you're going to sink down, and once you feel that tight spot, which I do, you're just going to maintain that pressure as you rotate your right leg in and out. So you're going to maintain that pressure as you rotate your leg in and out. You're just going to do that for about 2, maybe 3 minutes. And just try and do some nice deep belly breathing as you're doing this. So don't try and hold your breath, don't hold tension in your abdominal wall. Just try and maintain that pressure and be nice and relaxed. And over time, it might feel less intense, might even start to feel better, or you may not even feel anything at all because it's starting to really release. It just melt into your fingers. All right, so let's say I did that for about 2-3 minutes. So you're just gonna sit on up and just see how it feels. So I'd recommend trying this technique if you're constipated, or if you have SIBO and your doctor told you that your ileocecal valve might be a little bit stuck. Try this out and see how it feels.